Hi everyone. I think 2025 has been a bumpy year with both ups and downs. However, for the European Huntington Association, some major achievements have been made. In September, we organized our 5th conference in Bucharest, and it was a wonderful experience to be there together with more than 250 people, healthcare professionals, family members, and drug developers. I went home from that event with great pride in the strength and in the warmth of the Huntington community. And I also went home full of inspiration to continue our efforts. And as well in 2025, the EHA team, together with their partners, made a huge effort and had the Huntington Academy established and online. This is a wonderful resource for everybody taking care of HD patients, being family members or healthcare professionals, or even for those who want and need to take care of themselves. This resource was made possible because people were willing to share from their everyday experience and practice and wisdom taking care of somebody with HD. Thank you so much for your contributions. For all of you who haven't checked it out yet, you should. You find it online. Another success we have done in EHA is the great work we have been doing through HD-CAB in partnership with the International Huntington Association and the HDO, where a wonderful group of people provide drug developers input in terms of what the preferences and the needs are in the community. And this work has also got us close to a couple of the downs we have experienced this year, where approval authorities both in Europe and in the United States has told two respective companies that they need to do more trials, more studies into providing data before they are willing to consider and evaluate the efficacy of their therapy. Now, I know that many researchers and clinicians agree to these decisions and think they are the right ones. They think we need to be on the safe side. I can understand that, but on the other hand, people are suffering. They are deteriorating as we speak. I think decision makers needs to be a little bit more bolder than what we currently see. And this year I've actually been thinking that we need to speak louder and more about the enormous unmet needs and the burden that HD entails for people. I don't think that the regulators fully acknowledge and understand that aspect of it. So that's one of the objectives we have for 2026, is to be that voice and to collect stories about how daily life with HD is. So we need your support and we need your contribution. And we are so grateful for what we have achieved, but there is a lot more work that needs to be done. We will not rest until we have efficient therapies for patients available regardless of where they live. So not an easy task, but it's possible. We have seen it in other rare diseases, in other neurological conditions, earlier unsolved and with no therapies whatsoever. So this is possible also for HD, and we will make it happen together. Wish you all a happy and prosperous 2026. Thank you.